Hi everyone, welcome back to our third lecture. So in this lecture we'll also talk about Kat's paper. So it will be about critical reflection on informed consent. So a concept that is both central to modern medical ethics and, according to Katz, still deeply misunderstood and poorly practiced in modern medicine. This paper, Cass asks this question: so informed consent, is it something real or is it just a fairy tale and will always be a fairy tale? So his answer was pretty complex but pretty clear as well. Cass thinks that informed consent, as it commonly practiced, often fails to live up to its ideal. So he thinks, and he was pretty pessimistic about it. So he thinks it remains more of an aspiration than reality. Let's introduce informed consent a little bit. So Cass opens by tracing the prehistory of informed consent in medicine. So he reminds us that for most of the medical history, the physician-patient relationship was defined by silence, obedience, and authority. So from the Hippocratic Oath to the AMA's 1847 Code of Ethics, doctors were expected to act in patients' best interests without involving them in decisions. Autonomy was not even part of the conversation, and I guess patients are not even in conversations with doctors. So when American courts introduced the doctrine of informed consent in the late 1950s and early 1960s, it was a revolutionary break with tradition. Suddenly, doctors were legally required to inform patients about the risks and alternatives to treatments. But Cass argues that while the legal doctrine changed, the culture of medicine and the practice did not. The legal systems, Cass argues, has played an important but limited role, so courts have generally framed informed consent as a duty of disclosure meant to protect doctors from liability rather than to empower patients. He criticizes the overuse of the therapeutic privilege, where doctors can withhold information if they believe disclosure will harm the patient. In practice, this undermines autonomy. Cass argues that we need more than just legal mandates. We need a cultural transformation in medicine itself. The goal is not just to avoid lawsuits, but to truly respect patients as autonomous agents capable of making meaningful choices about their lives. One of Cass' most striking arguments is about medicine uncertainty. So, with the rise of scientific medicine, doctors can now identify a range of treatments, but each comes with its own risks, benefits, and unknowns. And also, as philosophies of science and science and technology studies, and also sociology of sciences progress, we now know more and more that medicine and sciences are not always as certain as they appear to us, and not as always as so authoritative and certain as they appear to us. So Cass argues that physicians are often reluctant to acknowledge these uncertainties to themselves, let alone to patients. But if doctors cannot or will not share their uncertainties, how can patients make informed decisions? Right? So true informed consent requires a conversation about not just what is known, but also what is unknown. Cass also argues that the idea that doctors or patients currently make decisions together are a bit suspicious. Too often, he argues that doctors present one option, frame it in a way that nudges the patient towards compliance, and then call it informed consent. So that's nudging, that's not informing, consenting. So this isn't real collaboration, is persuasion disguised as dialogue. So if you go and watch like a medical show, sometimes you see that, and that seems to be internalized a lot in a lot of medical professionals. So sometimes a doctor, if was too brutally honest, they might even be kind of discouraged for informing the patients too much. So at the heart of Kat's argument is a commitment to patient autonomy. So Kat argues that autonomy is fragile. It requires support, communication, and recognition of patients as fully developed adults. But for Cass, the alternative is worse. So a world in which doctors continue to act as benevolent dictators, making life and death decisions without the true patient input. He thinks this is so much more scary and is so much worse than having fragile autonomy. So Cass challenges us to imagine medicine that honors psychological autonomy, where conversations between doctors and patients are real, respectful, and capable of supporting complex personal decisions. And I think a lot of such conversations are happening right now in the philosophy of science, and also like history and sociology of science, which talk about that science and medicine have so long been one-way conversations, but now we need more two-way conversations in these fields. The last part of the paper, Cass thinks about the moral authority of doctors. So he tries to kind of reframe their roles and try to look at doctors from a refreshingly new perspective. So he thinks that we should not see doctors just as all-knowing experts, but as caring partners who help patients navigate uncertainty and choice. So he feels like that's a much more human perspective towards patients. So he calls for a new kind of caring, one that includes respecting patients' right to decide for themselves, even when the outcome is uncertain or painful. And Cass closes with a warning. So unless medicine commits to this ethos of joint decision-making and respect for autonomy, informed consent will remain, as the title suggests, a fairy tale. So at the end, he thinks that there are a lot of things we could work on and work towards, but right now, this kind of informed consent and joint decision-making is still an ideal, but we can move closer to it. We can put in a lot of efforts to make it better. So that kind of ideal is right now a guiding image or guiding principle for us. So that basically is Cat's picture for informed consent. So his answer was, okay, it might be very hard and it might be ideal to a certain extent, but we can certainly move towards it and we can certainly achieve it in a lot of non-ideal ways, imperfect ways. It's not something that's completely impossible and inaccessible. So I also prepared some discussion questions for you. If you're interested, you can also look at them and maybe talk about them in the writing assignments or the writing responses, aka the discussion posts.